Hello everyone and welcome to Brett's Brain Blog. My intention when creating this network, this blog, earlier today was to gradually educate everyone about my circumstances and then sort of delve into my day-to-day struggles. But if I had chosen to do this sooner, that would have been easier. But now I think I am going to use this to try and keep me as grounded as possible when I get like I am right now. I am tremendously agitated. It's a feeling in my mind like something is horribly wrong. And it's okay to say that here. I'm so used to saying that to doctors, and their response is always, well, that's too vague. You need to tell us what's wrong. And it's the most frustrating thing in the entire world because I don't know what it is that feels wrong. I feel foggy-headed, confused, overstimulated, anxious, upset, and just something deeper than all of that. There is something wrong with me, and I don't know how to express that any clearer, but I do know that a lot of the time there is a tremendous struggle, like right now, to not get in the car and go back to the emergency room, because I know that short of putting me in a psychiatric hospital, they're not going to do anything to help me. And, you know, a lot of you watching this may say, oh, well, you're just having an anxiety attack. I've had anxiety my entire life. This is far more intense. I've had severe panic attacks my entire life. Sure, I'm not hyperventilating, screaming, and throwing the phone right now. I'm using it to record this. But this is something cognitively wrong. This is not necessarily adrenaline. I am upset right now because of how disturbed my mind is. Inside of my mind, the way it is functioning, the way that my thoughts are processed, there's something off. There's something wrong. And sometimes that manifests in a way that's so frightening and disturbing that I become tremendously agitated. But even then, it's deeper than that. What I'm feeling is so intensely horrible that there are no words that I'm aware of in the English language that can truly articulate what I am feeling. I can start at the smallest level and say, the muscles in my neck are tense. There's pressure on both sides of my face and my head. There's tingling and pain throughout the back and side of my head. It's hard to focus, it's hard to think clearly, and it feels like something is so badly wrong inside of my mind that I could just snap. I don't know. I want to physically reach inside my head and rip my brain out. I mean, it's horrible. It's nightmarish. It's like hell. And, you know, it may go away. Well, I mean, it's not going to go away. It hasn't gone away in 2 months. But it may ease off in a few minutes, and I may be able to chill out and have a funny little conversation while masking the fact that I feel miserable. But the fact that this feeling does come, and the intensity of it is increasing every day, means that eventually there's going to be a breaking point. I do need help. I do need medical attention to address what is wrong with me. But I have received complete and total rejection from the medical community. I have seen sports medicine doctors. I have seen primary care physicians, nurse practitioners, psychiatrists, psychologists. I have seen dozens of emergency room doctors, Well, it's probably closer to a dozen if you want to be literal. And they look at me, and I'm not bleeding. You can see that. I'm not bleeding. I don't have an arm chopped off. They can't physically determine anything, so therefore there must be nothing wrong from their perspective. But I mean, that's so messed up, because, like, what about problems in your blood? You know, like, what if I had some sort of, disease that's in my blood? Or what about infections? What if there's a viral or bacterial infection in my brain? You know, there's a ton of stuff that it could be, and I don't want to play doctor, because then you just freak yourself out, and then when you go to the doctor and say, hey, I think I know what's wrong, I figured out what it is, they get angry, because, you're doing their job, and they're trained to, and you're not. But what else am I going to do? If they're going to ignore me and say, we don't know what's wrong, go home, leave us alone, and even get an attitude and yell at me. Some of these doctors have actually yelled at me, which I didn't, until this started, I didn't realize, like, some of them are so hostile. What the hell is that? Why? Why would you be mean to your patients when they're suffering? I mean, sure, it may appear that I'm just going insane and that I don't need urgent medical treatment, but there's a lot of really serious, legitimate physical medical conditions that present with someone feeling like they're going insane. I mean, what if I had a brain tumor? What if I had brain cancer? What if I had meningitis? But they don't care enough to check for that stuff. They just look at me and say, this guy looks like a basket case. Let's get him the hell out of here. And I've seen so many doctors, I've given up on that. I don't think that any of them are going to help me. I have an appointment with a neurologist in 16 days, but over the past 3 days, I have reached a point that in my journal, where I record everything, I refer to my life in chapters right now. We are in chapter 3, which started last night. I call it, what did I call it? Hold on. Part 3, Into the Nightmare, okay? Like, I'm not trying to be an emo kid, dark and cynical. My life is literally like a fucking nightmare right now. I feel so disturbed and so agitated and worked up, that, like, I want to just, I don't even know, something drastic, something not good, and I need help, and nobody wants to help me. And as my health deteriorates, this isn't purely physical. I've got pain in my head, pressure that feels like my brain is going to frickin' explode, kind of like sinus pressure, but intense, like really intense throughout my head. And, people, they're uncomfortable with this whole thing, because I am miserable, and they don't like to see that. It makes them uneasy to imagine that a person could suffer so much or whatever. But, maybe nobody will ever watch this video, or the entire length of it. That's not my concern right now. This is serving a purpose. I was laying here on this leaky air mattress, and I was reaching a point of agitation and mental disturbance that I felt like I was about to snap, maybe hurt myself. Whoa, shit. Sorry. The pressure in my head just shifted, and it scared me. It was like really intense, like someone punched me in the face, but obviously nobody punched me in the face, but it felt like it. See, this is what I'm talking about. That is a perfect example of things that doctors don't get the opportunity to see, but it makes my life really, I'm losing it, There's something going on with me. But anyways, I was laying here, getting so worked up that, it may have reached a point where I truly needed to go, to the emergency room. And since they obviously have no interest in treating me there, because I've been to 10 hospitals, it may be more. I'm not keeping an accurate track. I have my medical records, my discharge papers. I could count them up. I know it's at least 10 times in the past month or so that I've been to the emergency room. And they always tell me this is not an emergency leave. But there is a way, an effective way, for me to establish round-the-clock care, but it's not ideal at all. I've already been admitted to a psychiatric hospital once since this started. I was there for 9 days, and they said, obviously, this is, not a mental illness. I mean, I do have anxiety and bipolar disorder, but they were like, that's not what this is. They were like, there's something neurological going on. You're having memory loss, feeling like your basic ability to process thoughts is diminishing over time. They said, unless it's schizophrenia, which I don't hallucinate, so it's not. They said, we don't know what it is. We don't know how to help you. But if I go back to the hospital and tell them I'm experiencing severe psychological disturbances, I could easily get them to put me back in a mental hospital. But it's not an ideal solution. But I would have round-the-clock medical care, so if something did happen where I needed help, they would have nurses and doctors all around me 24/7. But see, talking to this cell phone camera right now, talking to all of you who may or may not choose to watch and listen to this struggle that I'm going through, it allows me the opportunity to ground myself, to refocus, to not get trapped in my own mind to the point where I need to go somewhere like that. Because as I stated before, this, I have an appointment with a neurologist where they can establish if this is being caused by the brain injury that I suffered, which it probably is. I mean, I don't know, maybe not. Or to say it's not, and that I may have a viral infection in my brain or something like that. But, sorry, it's happening again. Sometimes it's like somebody just, wipes everything out of my brain, like just clean slate, like an eraser erasing a chalkboard. It's like all the information's gone. I have no idea what I was talking about. I do know that I'm recording myself, and I know that it's for the sake of calming myself down and talking about my brain problems, but I don't remember anything else that has been said. So I know I don't feel good right now, so I was probably venting, trying to calm myself down and not sound too crazy. But I don't know what I was talking about. I don't remember at all. It's gone, it's just gone. Some people say that these memory lapses may be seizures, and I may go back and watch this video to make sure, but usually that kind of shit you see, it's like, you space out, like, I don't think I did that. But then again, they also say you don't remember it, so maybe I did. Maybe I should go back and watch. But I'm fairly certain these memory lapses are just immediate. I'm in the middle of talking, and then boom, what was I talking about? So, it is what it is. And I mean, I look like shit, I know that. And my personality right now is probably extremely unsettling. So I don't expect any of you to have watched this whole video. But I just don't want to feel so alone. I want people to watch, and I want people to understand. But first off, everybody's busy in their life, so they don't have time to care that much about me. Secondly, this is probably unpleasant to watch, so why would you watch? We're at 15 minutes. Why would you watch 15 minutes of this? But I just don't want to feel alone. I feel like I'm losing my mind and possibly dying, and I just don't want to feel so isolated. But I don't know. All of you have watched the whole thing. If you have watched this whole thing, I love you for that. I really do. And if you did, tell me that you watched the whole thing, even if you don't have any good advice. That way I'm like, hey, there's people out there who give a shit. There's people out there who care enough to at least understand what I'm going through, even if they don't care enough to help me. Which is still a big deal. It takes a lot of effort to even understand, let alone help. Anyways, that's it.